Hello there. Today I'll be talking about mumps. What is mumps? Is mumps dangerous? Is it a curse from the gods? Welcome to Your Health Today with Dr. Yide, where I talk about your health and wellness. I am Dr. Olaide Jinadu. If you're not yet subscribed to this channel, I think you're missing out. Why don't you subscribe right now, then hit that notification bell so that you get notifications every time I post new videos. Now straight to the chase. Understanding mumps, its cause, symptoms, diagnosis, and treatment. I will be following this outline. A brief introduction. Mumps is a very contagious, acute, self-limiting viral illness. Now, what do I mean by acute? The word acute has nothing to do with severity, but everything to do with timing, the chronology. It talks about how long this disease has occurred. When we say acute, we mean of sudden onset within 24 to 48 hours. The word self-limiting means would run its course naturally, just like most viruses. Mumps virus is a self-limiting viral illness. It is characterized by swelling of one or both salivary glands. There are about 3 major salivary glands in the human body: the parotid gland, the sublingual gland, and the submandibular gland. The mumps virus has a predilection for the parotid gland, meaning it infects the parotid glands most of the time. What's the cause or the etiology of this mumps infection? Mumps is caused by an RNA virus. Now, there are 2 major classes of viruses. We have the RNA virus and the DNA virus. The DNA stands for deoxyribonucleic acid, while the RNA stands for ribonucleic acid. This mumps virus is of the genus Paramyxovirus, a member of the family Paramyxoviridae. Epidemiology. Now, what is epidemiology? Epidemiology talks about the incidence and prevalence. How prevalent is it? Where is it found? What gender or what sex is it found in most? Is it male? Is it female? That's what the epidemiology talks about. Mumps is cosmopolitan, meaning it is found everywhere. No gender predilection. It's equally found in males and females. It occurs commonly within the ages of 5 and 19. The mode of transmission. Humans are the sole reservoir of the mumps virus, meaning it's not zoonotic like the coronavirus, the SARS virus, or the MERS virus. It is transmitted from person to person through respiratory droplets, saliva, and direct contact, meaning if anybody infected with the mumps virus sneezes around you or coughs around you, you can get it from them. It is highly contagious, don't forget that. It has an incubation period of 16 to 18 days. Here's a diagram that summarizes its mode of transmission. It is worthy of note that maternal antibodies protect during infancy. How does the baby get the maternal antibodies? Yes, you guessed right, from the breast milk, especially that from the first 3 days of life. The first 3 days breast milk is known as colostrum. It has this yellow color. It is very rich in antibodies. So mothers, ensure your babies always get their dose of breast milk. That being said, about 20 to 30% of persons with mumps virus are symptomatic, meaning they exhibit symptoms. The mumps infection is more severe in adults than in children. It is also worthy of note that a lifelong immunity is usually conferred by clinical or subclinical mumps infection. What does that mean? Means if you've been infected by the mumps virus before, you most likely are going to have a lifelong immunity against it. Signs and symptoms: low grade fever, headaches, malaise. Malaise talks about generalized body weakness and pain, and this general feeling of unwellness. Ear pain, especially when chewing from the affected side. Don't forget that the mumps virus has a predilection for the parotid gland, and the parotid gland overlies the muscles of mastication, the muscles that ensure that we chew properly. There can be associated sour taste in the mouth from excessive salivation from the inflamed parotid glands or other salivary glands. There could be a sudden hearing loss, which is usually temporary. Diagnosis. How is mumps diagnosed? Just by looking at the patient's jaw, you can actually make a diagnosis of mumps, but you need a confirmation. The mumps infection can be confirmed from a positive mumps test. The virus can also be isolated from nasopharyngeal swab, blood and fluid from the buccal cavity, CSF, which stands for cerebrospinal fluid. Now, a mild digression. The spinal cord resides within the vertebral column, the backbone. The spinal cord is surrounded by an ocean of fluid called the cerebrospinal fluid. This virus can also be isolated from throat washings and urine. Treatment. Like I said earlier, it's a self-limiting infection, so there is no specific treatment. Don't waste your time with antiviral drugs. They won't work. It will just run its course. However, we treat the symptoms. So if there's fever, there's headaches, you can give antipyretics, analgesics for that. You also treat complications if they arise or if they are present. Prevention. How can mumps be prevented? Mumps can be prevented by ensuring that your children receive the mumps vaccine as at when due. The mumps vaccine comes alongside 2 other vaccines. That's the MMR. The MMR stands for measles, mumps, and rubella. Rubella is another word for German measles. Now, the MMR comes in 2 doses. The first dose should be given within 12 and 15 months of age, while the second dose should be given within the 4th and the 6th year of life. Complications. Now, when I say complications, it doesn't mean that everybody that has this infection would have these complications, just making us aware of the probable complications that might arise from a mumps infection. We could have a septic meningitis. Meningitis talks about the inflammation of the covering of the brain. It could be an encephalitis, that's the inflammation of the brain itself. Sensorineural hearing loss, polynephritis, epididymolysis. Now, this talks about the inflammation of the epididymis, which is the cord that arises from the testicles and the testicles itself. The inflammation of the testicles is known as orchitis. Epididymolysis is an inflammation of the epididymis and the testis. Another complication that might arise from mumps is pneumonia. Oophorytis is another complication. Oophorytis is the inflammation of the ovaries. Oh yeah, now you can see that the women are not left out. Another complication that might arise is arthritis. Thrombocytopenic purpura is another complication which might arise from the mumps infection, and this is simply a bleeding disorder. Myocarditis is another. Myocarditis is the inflammation of the muscles of the heart. Guillain-Barré syndrome is an autoimmune disease of the nerves. Autoimmune diseases occur when the body's immune system is confused and starts to act against the body cells. Now, in this Guillain-Barré syndrome, the immune system, the body's defense system, starts to act against the body's nerves. Thyroiditis, an inflammation of the thyroid gland, and cerebellar ataxia with encephalitis. The cerebellum is the hindbrain, meaning the brain behind at the back. The cerebellum is saddled with the responsibility of controlling our body movements. So cerebellar ataxia are jerky movements that come from a problem arising from the cerebellum. Prognosis. Yeah, the prognosis for mumps is very good, meaning you expect a fantastic outcome. Patient education. It is expected that every child confirmed to have mumps should be isolated from other children at least within a period of 9 days to ensure that this child doesn't infect other children, to avoid an outbreak. Ensure you wash your hands. Ensure the infected child and other children wash their hands, just like during COVID-19. If you just loved this video, I would have you like, push the comment, share, and subscribe to my YouTube channel. So we'll meet again, same place, same time next week. Don't forget, health is wealth. Bye for now.